Hello, my name is Chandra Matthews. I'm the Director of Programs at NextFifty Initiative, and I'm excited today to introduce Janine Vanderburg with Changing the Narrative. At NextFifty Initiative, language matters. We are intentional about the words we use when talking about aging and efforts to combat age discrimination. We like to encourage organizations seeking funding to understand and exhibit age-inclusive communication throughout their application. Today, we're presenting Janine in a short video for you to review to hopefully not only improve your language within the application, but increase your participation in the Changing the Narrative movement. Janine?
Hi, everyone. So my name is Janine Vanderburg, and what we are going to be sharing in this short video is some very basic concepts of reframing aging and why they're important in the context of ending ageism. And most of all, we want to encourage all of you to think of yourselves as the leaders in this movement. So Changing the Narrative started in 2018 with funding from NextFifty Initiative along with Rose Community Foundation. And we were thrilled when last month we became a campaign of NextFifty Initiative. And you can see how this is related to NextFifty Initiative strategic goals. I've highlighted with that red arrow, one of the goals is ageism is reduced. And we believe at Changing the Narrative that if ageism is reduced, it also leads to those other goals, including all of us who are older adults having improved quality of life, and that organizations who serve older adults will have the resources they need to succeed because more funders will understand the importance of funding aging issues. So this is about ending ageism. So let's start with the definition of what ageism is. Ageism is prejudice. It's kind of how we feel. It's stereotyping, and it's discrimination based on someone's age. It's important to note that ageism can also be directed against younger people. So if a younger person is told they're not experienced enough yet, they're not given an opportunity, that's ageism directed against younger people. For the purposes of this presentation, however, we're talking mostly about ageism that is directed to all of us as we get older. How likely is it that your own clients, your constituents have experienced ageism? Statistics from a number of studies show very high prevalence. We know that 38% of hiring managers in a study done last year by Resume Builder admitted to screening out applications based on age. 93% of people in an ARP study said that workplace age discrimination is common. A very compelling study that was done by the Urban Institute in 2018 showed that 56% of people entering their 50s were either pushed out or laid off because of age. Only 10% ever recoup financially. And we also know that this ageism doesn't just exist in the workplace, it exists in our healthcare system. 93% of people across the United States report that they have experienced one or more forms of ageism in their everyday lives. So it's highly prevalent. So we know that this negatively affects all of us as we age, and it certainly affects those that you are seeking to serve. We know that it harms our economic security. Research shows that experiencing ageism harms our physical and mental health, affects our memory and cognition, and it also shortens our lifespan. We also know that beyond the impact on individuals, that ageism has a really profound impact on our communities and the economy. There is less support for age-friendly policies and systems. We know that there is lowered funding for older adult programs, even as the number and percentage of older adults in every state and throughout our country is increasing. Research by Dr. Becca Levy of the Yale School of Public Health showed that ageism in healthcare results in $63 billion annually in healthcare costs. And we know from AARP research that workplace age discrimination costs the U.S. economy $850 billion. On the other hand, if we are able to address ageism, we know that the ability to cultivate age-positive beliefs in ourselves has these results, and this is all from research by Dr. Becca Levy and her team at the Yale School of Public Health. if we are able to think positively about ourselves aging, we have increased longevity on average of 7.5 years, improved health, greater likelihood of recovering from injury or illness, reduced likelihood of developing dementia by almost half, even among people who have the genetic markers of Alzheimer's. And the most recent research by Dr. Becca Levy showed that having age-positive reliefs not only improves our memory, but it can reverse mild cognitive decline after it has begun. So we know that there are a lot of benefits, not only in cultivating age-positive beliefs among ourselves, but among those we work with and those we serve. We also know we're not just doing this for ourselves as older adults. We know that ending ageism will benefit generations to come. The graph on the left shows the data from the US Census Bureau. And we can see that in 1960, we had a population pyramid in the United States that showed a whole lot of younger people tapering up to a very small number of older people. Because of advances in public health and in medical science, we now have lengthened a lifespan. And so the chart on the right side of from pyramid to pillar shows that we are moving more to a population pyramid where we have equal numbers of people across the lifespan. And so when we address ageism, we are helping all of people across the lifespan. The good news is that there are research-based strategies to combat ageism. The World Health Organization, in unison with other organizations, published a comprehensive report in 2021 as part of the global campaign to end ageism. And there were 3 effective strategies when all the research was examined that are known to actually address ageism successfully. And we're proud at Changing the Narrative that we use actually all of these strategies in our campaign. The first is education about ageism and implicit bias. The more we know, right, the better we do. We also know that intergenerational connection in education reduces some of that otherizing that sometimes happen. And finally, we know that addressing laws and public policies that are unfair are effective ways of combating ageism. So some of the things that we can do to educate ourselves about ageism is learn more about implicit bias. We know that all of us have it because of messages that we've received from the time we are very young. We form unconsciously these biases against older people. The good news is that just becoming aware of these biases makes us less likely to act on them and to treat people more fairly. One of the things that any of us can do, all of you watching this can do, is start with yourself. Harvard University has off its website a project called Project Implicit. This link here to the implicit association test is a live link. We'll be providing a presentation of a PDF of this deck where you can click through and take the implicit association test and find out to what degree that you may be biased in favor of younger people or older people. Spoiler alert, most people who take this test actually have been demonstrated to have a bias against older people in favor of younger people. So don't feel bad if you do. Do know that just being aware of that will help check your bias. The second link is to the Age Smart Inventory. This is brand new research that has been related by Dr. Kate Medeiros and her colleagues. And it's a great way by taking this inventory to identify age bias that you may have and also to initiate a conversation about it. A second thing that you can do to really educate yourself about ageism is to host a Becca Levy book club event. So Dr. Becca Levy has written this book, Breaking the Age Code, which we think is a really important book for any service provider, policymaker, individual older adult to read, because it really highlights how ageism and how the beliefs that we have about ourselves and about other people aging affect, as we said earlier, our health, lifespan, likelihood of developing dementia. Changing the Narrative has developed basically a series of questions with the permission of Dr. Levy. You can go to this link, download it. So read the book, get a group of friends together. It's a great, and talk about the book. It's a great way to educate yourself about ageism. The second thing that we know is really effective is fostering intergenerational connection. We have a toolkit that we've developed. It's called the On Same Page Intergenerational Conversation Toolkit. And it's a way to start talking to other people about as younger people and older people, how do we deal with stereotypes? What kind of stereotypes do we experience? And so that we can start coming together and reducing some of that otherizing that pits younger generations against older generations. We see a lot of that in the media. We see a lot of that in popular culture. But one of the things that we know is when we actually talk about it, it's an effective strategy to reduce ageism. And the third thing that we know is important is actually supporting public policy solutions. This is not a comprehensive list, but there are some examples. One of the things that we can do, for example, to reduce workplace age discrimination is eliminate age and graduation dates from job applications. We know that there are lots of workforce development dollars that are coming into communities across the country. We can use those dollars to upskill older workers. We can strengthen age discrimination laws so that they are on par with other forms of discrimination. We can champion caregiver support. I'm so glad that there's a growing movement to do that so that individual caregivers don't have to deal with this on their own, but we need public policy solutions as well. And another thing that we've championed at Changing the Narrative is removing age as triage criteria, for example, in crisis standards of care. So where does reframing aging play into all of this? Chandra started by saying language matters, stories matters. One of the things that we know is that narrative change supports social change strategies. So we have those effective strategies, education about ageism, intergenerational connection, supporting public policy. And what reframing does, narrative change supports all of those. We have some great examples from other social change initiatives. Marriage equality gained support and its strategies gained support when those behind it started moving away from rights and benefits language to talking about love and family. Access to healthcare advanced when we started changing the story to healthcare is a right, not a privilege. And we know that a lot more attention, for example, was paid to the opioid crisis when the story around it moved from individual addictions that needed to be addressed to a public health crisis. So reframing is a solid social change strategy. Why you? Those of you who work in aging, whether in organizations, in policy, whatever else, have the ability to be those trusted messengers to suggest to people why these new messages and stories are important. And so we're hoping that you will join us at Changing the Narrative and NextFifty Initiative in being those carriers of this new messaging. The good news is that an organization called Frameworks Institute gave us a path. This is a strategic communications firm that is based in DC. They don't message about widgets. They don't message about detergent. They message about social change issue. And what they do is conduct comprehensive research. They find out how the general public thinks about an issue, in this case, about aging and about ageism. And then they map messages that are actually effective in changing public perceptions in a positive direction. In this case, Frameworks did a very comprehensive study over 12,000 people who were demographically representative of race, gender, age, socioeconomic status, and political affiliation. And the language and the messages that we are about to share were demonstrated to improve our own attitudes about aging, decrease implicit bias, that stereotyping and discrimination against older adults. And importantly, it increased the public's understanding of the need and support for public policies that would create more age-friendly communities. So first, what Frameworks found was the current story is this, that basically aging is a time of decline and deterioration, that there's a very strong us versus them, so pitting one generation against another. And we see a lot of that, as I've mentioned before, in the media and popular culture. Frameworks also found a very strong theme of individualism. And essentially, people perceive that if someone wasn't doing well as they got older, it was kind of their fault, right? Didn't save enough money, didn't walk enough, didn't eat the right food, all of the things, and kind of ignored what we accept when we are talking about younger individuals. When we're talking about children and youth, we talk a lot about things like the social determinants of health and how important are. We understand that environment and context matters, but those were kind of absent from thinking when people thought about older adults. There was also very strongly a theme of nostalgia and threat of modernity. And nostalgia sounds like this, right? In the good old days, pensions were solid. In the good old days, Social Security was solvent. In the good old days, the kids took care of grandma. And of course, the issue with that is when we look backwards, we can't prepare ourselves for a society that is experiencing the kind of demographic change that we are experiencing. And the other thing is that we know that actually the good old days weren't that good for everyone, right? And then finally, and this was really important, when asked about, well, what should we do about this period of demographic change? And we have more older adults, and what kind of solutions are there? People came up with either highly individualistic solutions, things like, well, people should save more money or more education. I will say, as someone who served on the Denver Commission on Aging for 4 years, we always had educational and resource fairs. But at some point, we needed to step back and say, the underlying issues are we don't have enough affordable housing for everyone. So simply having a resource fair where people give out brochures, but there aren't the right services underlying it, are problematic, right? So those were some of the findings. Those are the stories that we are trying to move away from. So let's talk about the stories and what the research showed that we ought to be advancing. The first thing is to move away from that individualistic thinking. We need to, Frameworks calls it widening the lens. So think of it as widening the lens on your camera. So instead of focusing on an individual, instead of talking about an individual job seeker that was pushed out of a job, we need to talk about the larger issue of workplace age discrimination. Instead of talking about a single eviction, we need to be talking about the lack of affordable housing options for people of all ages in our communities. We know that caretakers experience a lot of stress that was certainly heightened during the pandemic, but what we need to do is move that conversation, widen the lens to talk about the need for caregiving infrastructure. And instead of the digital divide simply focused on poor older adults, we need to talk about how digital divides play out across age spans in communities. The second thing that we need to do in our messaging is we need to talk about concrete collective solutions. Again, we're trying to move away from that very individualistic thinking. I give a workplace age discrimination solution here because I hear about this a lot at Changing the Narrative. And the stories that I hear the most about are about older adults across Colorado, across our country, who are wanting to work and who get pushed out, who are not being hired. An individual solution are things like dyeing hair or shave years off your resume. A collective solution, the solutions that we want to talk about in advance, are things like removing graduation dates from job applications. So that's just an example, and you'll have an example in your own spheres of work. A third thing that we need to do is we need to move away from the storyline of all older adults are, quote, in need of help. And I love the way Ken Dykewall frames it. Instead of in need of help, can we reframe older adults as being ready to help? And that was one of the findings of Frameworks Institute. We can reframe older adults and their talents and experience as resources to our communities instead of burdens. An organization or a collaborative of organizations that did this really well in Larimer County, Colorado, was the Partnership for Age-Friendly Communities in partnership with the Workforce Development Centers. And they created this short film called Profit of Experience. And the story that they advanced was, how do we apply our spirit of innovation and ingenuity to address hiring challenges that our local businesses are facing? Well, we do it by talking about older workers have that inside experience strong communication skills and connections. And the solution that they came to, the concrete solution, is employers can bring on older workers to help address their talent shortages and quote profit from experience. So this is kind of a great sample layup of how you kind of can move away from the poor older adult to let's look how older adults can be resources in our community. The next recommendation of frameworks was when we talk about ageism, we need to talk about it as a matter of justice. And we need to talk about the fact that justice requires recognizing that all members of our society are equal. And right now, very often, older adults are pushed aside, are not treated as equal members. We marginalize participation, we minimize contributions. And so what we want to do, we want to confront the injustice of ageism. We want to work to reshape our communities so that people of all ages are fully included. Here's an example of how this could work in an actual communication that maybe you were doing in a donor pitch, a grant proposal on your website. So one of the things I know I heard a lot of during the peak time of the pandemic, and I realize that it's not over, but people talked about, oh, poor seniors, social distancing is in place, they don't have technology, they can't access healthcare. Now, that's one way of telling the story, but what that reinforces is that narrative of older people decline, deterioration, can't learn technology, and that everything kind of is about healthcare. If we and it's also highly individualistic, right? But if we do this instead, if we rely on that value of fairness and justice, and we say, in our community, we actually believe everybody should have access to opportunity. And because of things like digital divides, some people have a harder time than others accessing healthcare, but also K-12 education and being able to work remotely. It wasn't just older adults, it was a lot of children and youth who didn't have access to technology. But we can come together in our communities to develop solutions. We can close our digital divide by ensuring all of our communities have access to broadband, and those who need it have access to technology and training. So that's a way that you can take kind of the same principle and move it from a very individualistic focus on a handful of older adults to a broader community issue. There are specific stories that frameworks recommended that we avoid. One of them is super senior stories, and super senior stories, if you're in Colorado, a super senior climbs 14ers. She's in her 80s. She is going to be on America's Top Model, and when she's not doing that, she is building schools for poor children, right? That's a super senior story. And what we know is that those kind of stories both have actually two negative effects. They tend to individualize things, but they also tend to discourage everybody who's in that category who is not a super senior. And it also leads to either funders or policymakers saying, well, if some people can do this, obviously we don't need to support older adults. We want to avoid silver tsunami demographic crisis stories. The aging of America and of the world is not a demographic crisis unless we choose not to act. So we want to simply acknowledge that we are living longer, for the most part, for many of us, healthier lives, and we need to kind of rebuild our systems and innovate our systems and policies and programs to reflect that. Frameworks also found that comparing ageism to other isms or to civil rights actually was counterproductive in two ways. One, people who had experienced other forms of discrimination, whether it was racism or sexism, tended to think, well, ageism can't be as bad. And the most counterproductive part of it was that people tended to look then at strictly legalistic solutions, complain to the Equal Employment Opportunity Commission, instead of thinking of what are community-wide things that we can do to reduce ageism. And finally, there was a resurgence of what some researchers call compassionate ageism during the pandemic, where all older people were characterized as weak, vulnerable, and again, not with malintent. I mean, I heard endless numbers of elected officials, public health people talking about we must protect our weak, vulnerable elderly, but it created a climate that kind of reinforces all of that decline and deterioration, and basically positions all of us as we get older as not having our own agency, able to make our own decisions, and so forth. So we have specific language recommendations for talking about older adults and aging, for talking about demographics, and for talking about ageism. And I'll share these with here. On the left-hand side, you've got what to avoid. Frameworks research found that using the terms elderly, senior, and senior citizen actually reinforced a lot of the negative stereotypes about older adults. Their recommendation, which has now been endorsed by the Associated Press, American Medical Association, American Psychological Association, is to use older adults or older persons, or use descriptive language. And what I mean by that is, if you were describing the population you serve, you could say, we serve people who are age 60 and over who need support with meal delivery in Larimer County. I just made that up, but that's an example of descriptive language. Instead of they and them, you use us and we. The one thing each one of us has in common is today's the oldest we've ever been. Think of this before you go to sleep tonight. It's the youngest you'll ever be. If we are fortunate, we are all waking up tomorrow morning a day older. So we want to use us and we language. We want to remove and kind of also, mention to people who are using terms like battling aging or anti-aging that actually aging is living, right? We want to acknowledge that aging is a normal dynamic process. It's not like you wake up one day and you're like, my God, I'm old, so we're not battling aging. Aging is living. And we want to avoid any kind of language or suggestion that people made bad choices. We want to remove the choice language and instead talk about the importance of how can we work together? How do we collaborate with other organizations within our communities to improve the social context? And how do we come up with creative and innovative solutions? When we are talking about ageism, it is important to always define and explain how it works. One of the things that frameworks found was that a lot of people don't know what ageism is. And even though I know that that has changed significantly since frameworks did its research, I do know from my work and dealing with ageism every day that there's still a whole lot of people who don't know. So it's important to define it as that prejudice, stereotyping, and discrimination based on age. And giving workplace age discrimination as an example is the recommendation by frameworks. We don't want to compare ageism to other isms. We do want to talk about ageism as a matter of justice and fairness. And finally, when we're talking about demographic change, please don't use that term, silver tsunami, gray wave, or my favorite, going off the demographic cliff. We do want to talk about people are living longer and mostly healthier lives. Birth rates are declining. The combination of those factors has resulted in an aging population. And the good news is, I think we pride ourselves on our innovation, our ingenuity, and creativity. I want to encourage everybody thinking about this. Probably if you have secured funding from NextFifty Initiative, if you are proposing something to NextFifty Initiative, you probably have some creative and innovative ideas. Go ahead and highlight that ingenuity and how you are developing and re-envisioning what's possible in a society of demographic change. We can create new policies and programs to address a changing world. So how do you use this, the what's next? I'd encourage you to think about these three things as you're looking to apply these principles. Who are your audiences? Who are you speaking to? Is it media? Is it your constituents? Is it policymakers? Think of your audiences and how you could use any of those messages. What platforms do you have? Do you have a newsletter, a website, grant proposals? Do you give speeches? Do you give presentations? Think about how you can adapt those in any of those platforms. Think about where and how you can change the stories that you tell. We are here at Changing the Narrative to help you. If you look at that first link, the bit.ly link, Ending Ageism Together, you can click our Join the Movement forum, and that will sign you up for our mailing list where you'll learn more about upcoming trainings where we will do, for example, deeper dives into reframing aging and ageism in healthcare, about how we end ageism. You can always reach out to questions at info@changingthenarrativeco.org, and someone will get back to you. And these other blue links are different ways that you can check in with us on social media. So thank you so much for doing this and for listening. If you need anything, again, reach out at info@changingthenarrativeco.org. We are always happy to help.
Thank you so much, Janine, for sharing this information. And we at NextFifty Initiative hope that this information is helpful to you, not only in your application to us, but in future applications as well. Best of luck.